Okay, it looks like the recording is set. So Dr. Morris, if you want to begin. We can't hear you, Dr. Morris, if you're talking.
How's that? Is that better?
There you are. Yep, we hear you now. I do it.
Okay. All right, guys, welcome. I'm sure everyone has been having lots of fun this last few weeks. It's been very busy. Just going to go through our normal spiel. So this calls for the schools and the health department. This information will be posted on our websites within the next few days. So if you're not a school employee or health department employee, we ask you drop off just to reserve time for those that have limited time to be here. Just make sure you pass out this information to those who need to know it for day-to-day business. This is our epi curve from our wonderful epidemiologist. I showed this last week. Things have continued to grow. We've had one of the biggest increases. We have had the biggest weekly increases since this started. This is the state as a whole. This is not to scare you. This is just to let you know what's happening in the community. And it's also just to ask your patients. You can imagine how much work is getting thrown at our nurses right now. Cases are coming in so quickly that we can't get to them like we'd like to. There's some delays in reporting to us, so sometimes we don't even know that we have a case because we don't have the results yet. So just please be patient with us. We're getting to things as quickly as we can, but we just literally don't have enough bodies to do it. We're getting numerous phone calls with questions every day, and that takes up additional time from our staff that then they can't dedicate towards case investigations. So if questions can be emailed or grouped together in one call or something, we'd greatly appreciate whatever understanding you can give to our staff as we really try to cope with this right now. So I pulled some data to try to give you an idea of what's happening in the schools. I pulled 2 weeks worth of data for all 19 counties that I cover. There were a total of 2,042 cases in all 19 counties. I went through and I pulled all the cases that were in teachers, school educators, staff, and students that I could find out of those 2,042. 109 cases, so 5% of those total cases were in people that either were K through 12 students or worked at or for schools. So they may have been administration, worked at the ISD, been teachers. I saw one volunteer on the playground, bus driver, that kind of thing. 39% of them were actually teachers or staff. So a third of them were adults. 70% of them, 70 or 3% of the total cases, 64% of all the school cases were the students. So just as a comparison of all the cases of COVID in the state of Michigan, 10% of them occur in kids ages 10 through 19. They have interesting age groups. They either go 0 to 9 or 10 to 19. So right now we're seeing 3% of all of our cases occurring in our K through 12 students. So I just want to point that out. Again, this is very quickly pulled data, so I'm not going to guarantee this is exactly perfect, but it's certainly not 10% like we'd see in the state's age group of 10 through 19. So within that 2-week period, there were 4 situations that were labeled as an outbreak, which just meant there was spread within the school. And there was one case that was 5 cases. There were 3 other situations that only had 2 cases. So that was 11 cases total, or 10% of all the school cases. So a very small number altogether. All the rest, the 90% rest of the cases were acquired in the community. So all the other cases in the school were caught somewhere else, and they happen to be students or happen to be teachers. So while I was going through all these cases, I noticed that there were quite a few people listed as homeschool or learning or student online. I also noticed, I think, just one like online teacher. But there were at least 21 students I noticed that were listed as learning at home. So 1% of our total cases were students at home, meaning they have no interactions with a school, and they're learning at home to reduce their risk, yet they're still catching COVID. So I point that out just because there's still a risk of getting COVID even if you're not in the schools. We don't know everything about what they're doing, if they're doing any other activities, but just so you know. Okay, another thing, this is an article that recently came out from NPR, and it goes over some newer data about in-person school, that there's not as much risk of spread within schools as expected, and the benefits are great. Really, there's still a lot of schools that aren't even open. So this is really more of a call out that we really need to get kids back in school, but it does a good job of discussing things. So just if you need some good discussion points on this topic. I just finished listening to this media briefing that the Infectious Disease Society of America did with 2 infectious disease experts. One actually is based out of U of M. So it is a good listen, and it's done towards the lay public or to media. So just some good talking points. We're taking a public health informed approach towards schools. It doesn't mean we're going to have 0 cases. But it means that we're going to be ready to contain cases and prevent outbreaks. Returning or having school face-to-face is not 0 risk, but having in-person school is a huge benefit. The social gatherings and close contacts outside of the classroom are the main risk. Spread within the classroom is not often seen at all, which has just been demonstrated. I know there's been a lot of question and concerns from the community and from teachers and administrators and things about the data in our matrix. But one comment one of the doctors made, I think, was very perfectly stated. She said, we must look at several pieces of data continuously. There is not one number and not one single piece of information available to us that prompts a change, but a set of situations that must be considered when making decisions about schools. So I think I've tried to explain that in the past, but she really beautifully stated that. So that is pretty much verbatim what she said. And then one of the other experts said the community must take responsibility, and is the behavior of the community that will ultimately dictate if we keep our kids back in school safely, which is best for students' mental health. So there's a few typos there because I literally just watched this and just typed this as I was watching it. So again, I just wanted to share that with you because I know it's been hard coming up with some talking points as our community rates come up. And I wanted to show that to you before I show you the data because it's once again a bit higher. I also wanted to point out more and more places are doing what we call rapid antigen testing. That's where they do a little swab and they stick it in a machine and they get tests really quickly, but they report it to us either by phone or just fax us kind of a handwritten note. If it's positive, they're not reporting all of the tests that they're doing like they're required to with the PCR testing. So we don't know the total number of tests being done. So that is kind of falsifying our percent positivity to some extent. We really don't know how much it's affecting it, but it is possible the percent positive rate is a little bit falsely high at this point. Again, we don't know how much it is being affected. I don't think a lot of our counties in the northern area are using this test much, but I know Clinton County is using it some, and I'm sure some of our other counties are, but I just wanted to point that out, that there is a possibility some of them are falsely high. But I wouldn't say it's going to be a huge amount. Okay, so we'll share this as usual. For Central Michigan District, so the state data is up here. They're in the 170s with a 6% positivity rate. Central's had actually a few counties that have gone down in terms of their trend, but they're all in that highest category right now, over 150, and the percent positivity is up there. So this week I didn't pull all the data and look at it because I've been finding, you know, if you guys have a different opinion, you can let me know and I'll pull it maybe over the weekend. But I've been finding, you know, I really don't think it matters. If you, I think what's happening in your schools matters more than where the cases are coming from in the community at this point. I misspoke, you're not all in the highest. Aranac is in the high region, in the C region. So I'm sorry, I misspoke there. District 10, those numbers are here. Mecosta continues to run high. Ferris is doing a lot more, doing more testing. Ferris continues to have quite a few cases. So again, it is what it is. Again, I have the averages here from last week. The average for your 10 counties is here from last week. And then Mid-Michigan District is here. So everybody's continues to creep up, which is what we're seeing throughout the state. I think the state as a whole over the 2 weeks has gone up. I think it was 86% and gone up some as well. And the country as a whole has gone up too. So, okay. So if you're using the algorithm that we've provided you, you know, if kids have symptoms, you have to look at their risk of exposure. Every kiddo who has symptoms should get tested based on that algorithm because of the community rates are enough that they could have been exposed. So I just put another reminder in here about travel. I'm still getting questions about that. Questions asking, should people who travel out of state be quarantined? This is where the guidelines are on the CDC website. They state that if they do anything high risk, they should stay home as much as possible for 14 days after they come back home. A high risk activity is going to an area with high levels of COVID, which would be level 3 travel advisory for out of country, which is almost every country now, but there's a website, you can look that up. And then in states, there is, the CDC did change their map of the states. They do have rates per 100,000 now, so you can look at their website and that will help you to determine if there's a state with high risk. They go to a social gathering, a mass event, gathering crowds. So my suggestion would be, basically, if it has a higher rate than Michigan, you could choose to make them quarantine. It's completely up to you. However, my thoughts on this always are, if they drive from, you know, Cadillac to Detroit for a wedding, is it really different than going out of state for a wedding? So, you know, it's completely an HR decision on your part, but this is the official recommendation. So you look at this and you decide how you want to act. I have asked MDHHS this week if they could come out with some more specific guidance. So it's a little bit easier for all of us to make some of these decisions, because I know this is just really long and difficult to interpret. The other thing I popped in here, you probably got this, but we got an email of a press release that there's some grant money available. I didn't read all the specifics, but I just wanted to share it. And there's an email or a website you can go to get more information. So when we share these slides, you'll have this information as well. And that really is it. Today was just kind of a brief update. I wanted to give you those little bit extra data there and just some talking points. And then we'll just leave it open to question and answer now. So.
All right, Dr. Morris, I'm going to scroll up to the first question. Could you go over the difference between self-isolation versus quarantine again, please?
Yes. So when you are sick with COVID or you have a positive COVID test, either way, if you're infected, you isolate away from people. If you are healthy, but were exposed to somebody with COVID, you go into quarantine. So it's basically, it's very similar, it's just terminology. You isolate for 10 days past onset of symptoms, and when you're fever-free for 24 hours and feeling better, you quarantine for 14 days past the last day of exposure to someone with that's contagious with COVID. So it's just semantics, really.
All right, next question. What are the chances of the health department requiring a school shuts down for an extended period of time?
So I'll let my health officers chime in if I don't get this quite right, but at this time, we're giving recommendations and guidance and information. And even in the past, when there's been flu outbreaks, it has been up to the schools whether or not they close. If there were some awful situation where, you know, if COVID were spreading rampantly through the school and the school was not shutting for whatever reason, and we, from a public health safety standpoint, felt they really need to close and they're just not taking our advice, which we've never had that kind of thing happen before. But if for some reason it did, public health could then order a closure, but I don't think that's ever had to happen. So by and far, all closures would really be up to the choice of the school. Again, unless there was some reason where they just weren't taking the advice and we had to force that to happen due to safety reasons. So I don't know if any health officers want to chime in on that, if they're on.
We're here. This is Marcus. I think you said it exactly right, Dr. Morrison. That's, of course, because we've been talking about it among ourselves. You know, we do have the authority to do it in a serious public health emergency, and we would if things got that bad. But I'm much more interested in hearing from the superintendents and principals your opinion about that. That helps us understand what you're seeing and what you feel your needs are and how we can best support you.
Yep, and this is Kevin, and I'd agree with what Marcus and Dr. Morris have said.
So I think, because there may be times where public health wise, there's no need really to close, but we've had closures because there just aren't enough teachers, or there might just be a lot of apprehension in your community or in your teachers and you feel it's best to close. So again, we give advice, but you decide what's best for your community, your educators, your students. And again, if for some reason we had a school system that just was like, well, we're not going to listen to you. We're going to have school even though half our population died already. Then we could force it closed. But I don't imagine ever having a school that would ever. We've always had schools be very, very cooperative with us and very cautious and very responsible. So again, we advise you decide.
That's a good tagline. Okay, next question. How long are we to keep the daily screening logs?
For students and for staff, I know it's different, and I honestly don't know the answers. I think for staff, there's some laws to that, and you'd want to talk to your HR. For students, I don't know. I don't even know if you need to keep them. So those are things from a public health standpoint. From a health department standpoint, we don't really care. But from a MEA and employment law standpoint, you'll have to ask those individuals unless someone else on this call knows the answer.
Yeah, Doc, this is Steve. I looked it up while we were sitting here in terms of the MIOSHA emergency rules, and it actually does not specify how long you have to keep it. It just says, employers have to maintain it. So they're really, at least I haven't found an actual length of time that you're required to have it. It just says you have to have it.
It seems I saw somewhere where it said it's like an employee health record and you have to keep it 30 years or some baloney like that. So that's why, I don't feel comfortable answering that question.
Dr. Morse, this is Penny Dora. I
Yeah.
saw 1 year in an order someplace, and I would have to go back and find that. But once I find it, I could send it to you to send to the group. It was written in a formal, either at one of the emergency orders or the My Start plan, maybe, or someplace I did see 1 year. So
Okay.
if I find it again, I'll send it to you. But then I've also heard from someone else that told me SETSEG recommends 7 years for employees. So I will try to go back and see where I saw the 1 year thing, because that was something official emergency order or something like that. So I'll try to find it and send it your way. Great.
That would be great. Yeah, I can't keep up with all those things. But I don't know about students. In my opinion, if you're doing screenings on students, I don't think that you would need to keep them, but I don't know because they're not required. The employee screening was required by the emergency order.
Okay, moving on. Next question. Jeff Mount says, unique question. The Mason County Central School District owns the building and helps run the Scottville Senior Center. It has been shut down, and we're hoping to open with mitigation measures next week. With the recent increase in positive cases, would you recommend not opening at this time?
And is that meaning opening the senior center for seniors to come in? Is that what the question is?
Yeah, that's correct, Dr. Morse.
Okay. And what do they do at the senior center? Is it just to get together?
It's meals and socialization too, and activities, like the other senior centers across the state.
Okay. That's a tricky one. I know I had talks with Midland County. Just their medical director bounced some thoughts off of me when they wanted to open up their daycare for seniors. Because it's hard, they need an outlet and someplace to go. And they did set forth some really specific guidelines, but it is certainly a risk, and it's certainly a higher risk group.
Right.
So they'd have to have some really specific guidance how to do that safely. Do they have a director or someone that oversees that?
Yes, a really good one, and he'd be a senior himself, and is really cautious.
Okay, so I'd probably have them look at what other senior centers are doing, and if they have any kind of a parent organization, look for guidance.
Right.
And we're happy to, look that over or talk with them about it. But, and like I said, I have guidance for the daycare center, the senior daycare. That's a bit different because they're a little higher needs group. But I think it mainly has to do with consent and, people acknowledging that there is a risk and then making sure things are done in a safe way. But it's just like schools. It's kind of balancing the risk with the benefit because, seniors getting depression isn't good for them either.
Yeah, they've been alone for a long time.
Mm-hmm. Yep.
Thank you. Appreciate it.
Yep. No problem.
All right, moving on. Are most schools temping students? How often? From Bianca Campos.
So I know that there are a few, and I know that we, from the beginning, have said that you do not need to do that. So I will kind of open it up. If anyone is checking temps, you can step in and mention that. But the ones that have been, I know that they have mentioned they really haven't picked up anything, and some of them may have to stop because they do it outside and it's getting cold out and the thermometers aren't working well. So I don't know if anyone's on the call that wants to share their experiences. Well, no problem. Yeah. And, but again, I don't think it was very many. And again, I know for some, it's not really working anymore because it's too cold out. And from most people, they said they really have not picked up anything. And you're not required to. In fact, it's not recommended that you do it because it is so low yield. It requires that you get close to the kids. There's a lot of reasons why. So if there's any follow-up questions to that, feel free to ask them.
All right, we'll move on to the next question. If a parent refuses to let their child wear a mask, can the child still attend school? There's 4 questions here. Do we need to wear masks when outside, children and staff? Can we wear a face shield instead of a mask? Some staff want to wear shields because they never wear glasses or have anxiety. And I have a staff member who said it is against her faith to wear a mask. Is there a religious waiver? So 4 questions there.
Okay, so the first one was what? What was the first one?
Okay, if a parent refuses to let their child wear a mask, can the child still attend school?
If they have a written medical waiver saying what their medical diagnosis is, or that they have a medical contraindication to wearing masks, just saying they don't want them to is not a reason. There's a list of reasons in the order, and that's not one of them. I'm trying to find the list of questions here, but I can't find it. So you'll have to tell me the second one.
Yeah, that's okay. Do we need to wear masks when outside, children and staff?
If you can stay 6 feet away consistently or more, you don't need to. But, it's challenging, especially with little ones in recess. It's hard to keep them consistently 6 feet away, but if you can consistently stay more than 6 feet away, you don't have to.
Can we wear a face shield instead of a mask? Some staff want to wear shields because they wear glasses or have anxiety.
Only if you have a legitimate reason not to wear a mask. So if you have a medical exemption to not wear a mask, then you can use a shield instead. Of a face shield is not an equivalent to a face mask.
And then finally, I have a staff member who said it is against her faith to wear a mask. Is there a religious waiver?
No.
So then, Dr. Morse, with these questions, it's ultimately up to the superintendents or the administration to make determinations of how they would manage each of those scenarios, correct?
Correct. I mean, the epidemic order says you must wear a mask. So if their decision is to allow religious waivers, then that's going against the public health code and law. So that would be their choice.
Is it still true with the emergency order saying that Region 6 masks are recommended but not required, or?
Correct, and I forget about that. And so
No.
the emergency orders are no longer in effect. We have epidemic orders now. And yes, in Region 6, it does say for schools, they are recommended. And I apologize, I forget I do have some counties in Region 6. So yeah, for Region 6 counties only, for schools, they're recommended. But realistically, I mean, their numbers are going up as well. The schools really should have policies to strongly recommend, if not require them, but that is to the discretion of the schools in those counties. In the rest of the counties, it is per order to wear them indoors.
Okay, next question. We are getting many comments about when it makes sense to close. I realize that it doesn't appear to be spreading at schools, but at what point are we hurting the community by staying open? In other words, it seems like as people move about in the community, we are all spreading COVID. If people were told to stay home, would that help? Or would kids be hanging out together anyway, making it worse?
I know this is the ultimate question. If we said everybody has to stay at home again, we definitely would drop our COVID numbers. However, shutting down everything again would not go well. I think, the governor's authority to do that has been taken away, and I don't think any other person with authority would make that decision right now. One reason to close the schools would be if we felt that spread within the schools was contributing to the increase in our rates in the community. And I think, one of the reasons I pulled those numbers and went over those was to show that it really is not rates in the school that are then, so kids aren't spreading it in school and then going home and spreading it at home. They're catching it at home and coming to school with it. So closing school for that reason does not seem to be a need. Another reason to close school would be if a few people catch COVID at home, come to school, and then infect hundreds of people. That doesn't seem to be happening. With the flu, you can make arguments to close school because of outbreaks, but also because kids do tend to do that. They'll spread it all through school, then go home and cause more throughout the community. So, but again, from a bigger societal discussion, if we got everybody to stay home, everybody to stop going to weddings, birthday parties, bars, restaurants, playing sports, hanging out, doing group activities, we would see huge improvements. But how to get that done, I don't know the answer to that. So at this point, it does not appear to be, I can't see schools are the issue. I think it's birthday parties, weddings, funerals, gatherings, bars, restaurants, bowling alleys. So I don't know if that answered that question or not, but that's my answer. That's all I have for you on that one.
Says yes, thank you. Okay, next question. Our seniors have been reconnected by my agency through providing cell/tablets with data plans. This is working to reunite senior companions with shut-ins and foster grandparents with students, as well as each other. There is money available through community action agencies for this. I don't know, John, if you want to hop on and
I'll
talk
jump
a little more.
I'll jump I'll jump on quickly. This is John Van from 8CAP. And I want to clarify that that money is available for seniors whose income is at 200% of poverty or less. If they're more well off than that, they would have to just use this as an idea, but it has rejuvenated the issue that the gentleman was talking about with his senior center, because our people won't gather, and no way would I gather them in a center or group of any kind right now.
And I have a feeling probably some of our health department people, like our health educators or somebody, might know about that program. If not, or if the schools want to connect with you, I think that's great. That's really neat. All right.
All right, we'll move on. Penny says, could the health department promote a better understanding of what it means to quarantine, maybe a media campaign, etc.? We are finding lots of confusion from people who, one, feel better and don't think they need to remain in quarantine, and two, they tested negative, so they think they don't need to quarantine anymore. We could use some help with this. It seems no one adheres to their quarantine.
Yeah, and I know there's been some miscommunication down that way too about how long quarantine should be, and that's happened in a lot of places. And also, again, like I mentioned, with us being just so overloaded, people might know their close contacts, and it might take us a few days to get a hold of them, to talk to them. And if people just knew, hey, if you're a close contact, you need to stay home, and we'll call you as soon as we can, but you need to know what to do. We can think on
I can jump in, Dr. Moore.
Yeah.
From a public health, public information perspective, I mean, yeah, we continually push it out there. It's just difficult to always get in front of people all the time when they are in need of information. We have the information on our website, we post it on social media. Funding is limited to be able to put dollars behind an actual media campaign, which would require funding to pay for advertising. But we will continue to push that message out there, and maybe provide some good documentation or flyers or that type of thing that schools can post on their website to assist with that messaging. That would help.
I also recently put together a handout on quarantine. It was a free share that was from Resolve to Save Lives. And I know that there's a letter that we share with the schools to give to parents of kids that need to be in quarantine. I may just need to follow up with our nurses to forward that to the school so they can give that to kids. And then I probably just need to send letters out to our providers again to retouch with them about what they need to educate people of when they test them. It's just one of those things that I'd like to do, but it just has gotten buried in my to-do list. So we'll work on trying to get out information that you can more easily share with your close contacts at the school. And it really goes over what they need to do very, very well and detailed. And it's editable. You can even put your own logo on it if you want and everything. So we'll work on it.
Okay. Next question. I'm looking for a correct response with requiring a mask during an athletic event. We ran into a scenario where an individual did not wear one in and was asked, if you have a mask, could you put it on, please? The individual claimed we were breaking a federal law by asking him that. We never asked about a medical exemption and never asked the individual to leave. He ended up leaving on his own, but he stated he would be contacting his lawyer. Any guidance on this or verbiage for a correct response?
I have no idea how that would be breaking a federal law. I know there's been lots of claims about things like that and lots of lawsuits. From every legal response I have read, because I've read a few on this, you are allowed to refuse service to people who won't wear a mask. I mean, you can, again, I'm not a lawyer, but I can't imagine how that would be an issue. I think that there's chatter on social media that gives people ammunition on how to argue this, but I don't see how that would be correct. So if anyone else knows, chime on in, but I don't see how that would be correct.
So this is Marcus. Yeah, it's if you're having a sporting event or school or something like that, it's your responsibility to challenge people who aren't masking and to ask them to leave. If they won't, then comes the whole issue of how do you make that stick? So do you have law enforcement present to escort people off the grounds? You know, if you're a health department and you issue those kinds of orders and lawyer Neil Coleman comes to town, he's going to tie you up in court for weeks fighting about that. So it's our duty, schools and health departments, to protect the health of our students and employees by enforcing these orders. But that does not mean that just telling people to obey will result in obedience. They are gearing up to fight us on that. So it's a really awful situation for us, but no matter how horribly people treat us, you're not actually doing anything wrong by telling them to wear a mask or telling them to leave if they won't. It's what we all need to do, but only some of us are doing it.
This is Steve Scoville from Farwell. One Troon law firm has several briefs out on this, and the answer is that our schools have all been required to submit a plan that says we will follow that and require masks at athletic events. The Michigan High School Athletic Association also requires it as a second requirement. And so what we've been doing, and we've done it twice, is we just stop the event and the individual either puts their mask back on or leaves.
Thanks for sharing that. I appreciate that. And I think it's just people throw that out just as a bullying tactic. And but yeah, we've had a lot of, and I've seen people that have made false documents and all kinds of stuff. So hang in there.
Okay, so Anna Bateson, she is one of our public health nurses at District Health Department number 10. She provided a link to the CDC that gives guidance on quarantine, and that link is in the chat box. That might help some individuals with guidance on quarantine. Next question, how about sending the letter?
Yeah, I'll work on that.
Statement. How about sending the letter to the schools that we can share through our system? Okay. Next, when we follow the algorithm and telling parents about the 3 options regarding those 5 symptoms bullets, if their doctor chooses not to see them, would you say their only or next option is to go to a walk-in clinic?
That, or you can try to find a testing site that will test children without a doctor's order. And there are some out there. So if you go to michigan.gov/coronavirus test or call 211, you can search for testing sites. And there are some out there where they'll just test you without seeing any clinician. And for some locations, it is a little bit of a distance, but that is another option, is just simply to get tested. The final option is stay home for 10 days from the onset of your symptoms. I'm looking at, I found a new study kind of talking about the risks of, having kids come back without any of that if they have just the more mild symptoms. So I'm reviewing some other ideas just to see about ways to get kids back to school quicker. So I'm trying to make things easier, and I'll get that to you as soon, if I find that there's data to keep things safe. The sides to that are get kids back quicker and potentially bring COVID into your school, or keep kids out longer and not bring COVID into your school. So mute everybody.
Okay.
I talked to her this morning. She was all good to go. She confirmed it last Thursday, but then she's dropped it to the superintendent. Will not let them come.
Thank you.
I was trying to find that unmuted person and okay, so Dr. Morris, just real quickly on quarantine versus, so the 14-day quarantine versus the 10-day. So the 14-day quarantine is for those that were exposed to a positive case, correct? They have to quarantine for 14 days, and even if they get tested and test negative, they have to finish their quarantine of 14 days.
Correct.
The 10-day is if you had symptoms of COVID, or you had COVID, and that's how long you're supposed to stay home.
If you have a diagnosis of COVID, whether it's a confirmed case or a probable case, it's 10 days and symptoms improved and you're 24 hours without a fever. So whichever is longest. Usually it's just
and then if you just had symptoms but were not exposed to another person that is positive and you get tested and it's negative, then you can resume normal activity as long as you were not exposed to a positive person. Is that right?
Well, that's kind of the discussion there about being tested or not being tested. If you have symptoms of COVID and you're not tested, we have to assume you have COVID and you're out the 10 days.
But I thought you only assume that you have COVID if you know that you were near somebody with COVID or exposed to somebody with COVID. If you weren't exposed to anybody with COVID and you have symptoms like a cough or something along those lines, that it could be something else. But you're saying if you don't get tested.
So if you don't if you're an adult, if you're an employee, the recommendation is whether you get tested or not, you're supposed to stay out for the 10 days. And that's just because of the risk of false negative testing. Again, it's up to the employer whether or not they want to do something different than that. But it's just because on a good day, on the best day possible, the test has a 20% false negative rate. So 1 out of 5 times that test is wrong, and you could bring somebody back in your workplace that has COVID. If you don't get tested, adult or child, and that person has symptoms of COVID, again, sometimes it's hard because is it a major symptom, a minor symptom? But if they have symptoms of COVID and they don't get tested, they might not know if they've been exposed to someone with COVID because we have community transmission right now. So you have to assume, unless proven otherwise, they could have COVID, so they must stay home the full incubation period, the full isolation period.
Okay, which is 10 days. So then what if they get tested and it comes back negative? Would they still have to stay home the full 10 days?
Again, it's very difficult. The safest thing is to stay home the full 10 days because you don't know if it was a false negative, but realistically, you can look at what their symptoms are like. And if it's like, yeah, I was a little bit nauseous, like we had a situation where everybody in the family had nausea and diarrhea. And they tested negative. Well, they probably had a stomach flu. So then you're not really worried it was COVID and they had false negative tests. If someone has fever, sore throat, runny nose, and a cough, and their test is negative, I would say you still need to stay out for the 10 days because I don't trust that test. Or get retested in a couple of days. So that is very challenging, and it's not an easy thing for everyone to do, but we can only give the advice that we can give. It's not going to be, there's no
It's not an
perfect.
exact science. Yeah,
Yes.
but I think that does give some clarification as to exposure, non-exposure, symptoms versus no symptoms, negative test, and the whole 14 days versus 10 days, because I think that's where there's confusion. It looks like somebody's, again, confused about the 14-day. But let's go back up to the questions real quick. If an employee has already had COVID a couple months ago, would they need to quarantine again if they became a close contact of someone who currently has the virus?
If you get exposed within 3 months after so if you had COVID before and you get exposed within 3 months of when that last infection started, you do not need to quarantine again. If you had a confirmed case before. If it's past 3 months, you do need to quarantine again.
So that's kind of the cutoff. 3 months. If it's prior to the 3 months, you don't need to quarantine. If it's after the 3 months, you would need to quarantine. And possibly if you have symptoms right after that 3-month period, you may have it again, so she'll get tested.
Right, and that can be something you and your healthcare provider can discuss, or you can always call us and ask.
Okay.
Dr. Morris, this is Steve Scoville with a question.
Yeah.
Because of all the quarantine rules, and I've dealt with this with the confusion about who and whether it's 10 days, 14 days, that's the document that I think if almost like a frequently asked question type document that would have the health department logo on it that we could share out to all of our parents as an informational document with here are the general rules and the why behind it. Generally, when I'm able to explain it to parents with what you've just gone through, they get it. But without that, there's all the rumors out there. So a 2 to 3 page document with some of those facts. I know you can't cover it all because there's so many factors, but grouping it together into why 10 days, why 14 days, why do I still have to stay out if I'm positive because of these symptoms, and giving that to the schools so that we can share that out through our system wouldn't cost you any money. It's more than what you can do in a 30-second commercial, but it might help educate our public.
And I thought a lot of that was on the CDC FAQ, but if you want to email me some specific questions to address, I will try to get to that.
No, and I understand you guys are overwhelmed. The other thing I saw that Grand Rapids Health Department put out today that they were going to stop doing in-person contact tracing calls and do a robocall to all the people to try to get it done within 24 hours and then allow people to call back with questions as a way to manage the volume. That might be something to look at as well.
Well, we're working with the state to have them help us, but they've become overworked as well and are trying to hire more people. So And they use a text-based method, so I don't know.
Yeah, Dr. Morris, this is Kevin. We did actually have some conversation on another thing this morning about exploring some of those other options that are out there. Whether we'll move forward with anything, I don't know, but.
Okay.
I also wanted to add that we did.
And you know, go ahead.
Sorry, this is Jackie from Central Michigan District Health Department. We did send out some handouts kind of early on along with our toolkit that kind of explained some of the quarantine versus isolation kind of stuff. So when we go ahead and send out the school data again, as long as it still matches the current recommendations, which I think it should, we'll include that to kind of help so that you can send those out to parents as well, that information that I think touched upon, but I'll double check to make sure.
Yeah, that sounds good, Jackie. So Catherine Rayburn, you have your hand raised. Do you want to unmute yourself and ask your question?
Thank you. For some reason, my chat's not working. You touched on this earlier, so I'm sorry if I'm being redundant, but if I have an employee who goes on vacation to a level 3 country and then comes back and has a COVID test and is currently waiting for those results, if that's negative, can that employee come back right away, or do they have to wait in quarantine? If it comes back negative, can they come back?
So it'd be advised that they still stay home the 14 days. That would be similar to the discussion about testing out of quarantine, because there'd be concern that they would have a false negative test. Yeah.
Thank you very much.
Yeah, you're welcome.
Okay, moving on. What is your advice for handling community-sponsored events that are taking place in lieu of school-sponsored events that have been canceled due to gathering restrictions, i.e. a local parent group / business holds a homecoming dance for kids that all go to the same school?
Well, I wish somebody would give us advice because we have a hard time with this. There have been numerous different events like this that parents have had, and we've tried to get them stopped, and we've tried to educate people. And unfortunately, 2 of them were scheduled in school districts where there were cases and outbreaks going on, at least 2 of them, maybe more. And again, we try to educate, we try to do that. I probably sound like the biggest meanie pants in the world, but I mean, I know that this is really hard for our kids, and I know that we just want to have normal again, but I also don't want school to shut down for 2 weeks because of an outbreak, and I don't want somebody's kid to end up in the hospital or to die, or a teacher to die. And I want to be able to have people have fun in a healthy, safe way. And some of these events have been touted as, don't wear your mask and don't tell anybody what we're doing events. So we're trying to educate and promote safe, healthy behaviors, but we're not getting far. So my advice is to continue educating and trying. I don't know what else to do. Like I said, we have tried and tried on these kinds of events, and I don't know what else to do. I'm happy to take anybody else's advice.
Anybody else have anything to share about events, dance? I mean, I know the health departments, all 3, I'm sure get this email all the time. We just got one today, again, about what can they do, and it's just a difficult thing to manage. Okay, hearing none, let's move on. My child's doctor said they aren't seeing patients, but they are doing video appointments. I can't imagine a doctor refusing to see a patient completely. That was from Hillary.
Yeah, some are kind of triaging, and that is actually a recommendation, is to try to triage people that are having symptoms of upper respiratory illness and do televisits, mainly to help keep our healthcare providers safe and healthy. There's been a lot of COVID in our healthcare providers, and I think I recently saw a report that we've had 9 healthcare providers in the state die from COVID so far. So I know it's hard to imagine that a provider wouldn't see somebody, but we want to keep them healthy too. The problem with that is, trying to get testing accomplished. As long as they're able to order testing and get them tested, that's okay. It's just, it is difficult. So most providers are seeing them in person now, but again, it is actually advised that as much as you can do remotely for sick people, that is safest.
Okay, moving on. Is it true that a person living in a household with a positive case do their 14 quarantine days not start until after the person who is positive has completed their 10-day isolation?
So I'm going to try and share something here real quick. I was kind of hoping that would come up. So this is the page, I think this is the page that Anna was sharing earlier. This is the when to quarantine page from the CDC. And if you scroll down, it tells you when to quarantine, and here it goes over the 3-month thing that we just talked about. If you've been sick before and you get exposed within 3 months, you don't have to quarantine. And here it goes through scenarios. So here you were in close contact with someone and you're not going to see them again. Here's how when you'd go in and out of quarantine. Here's where you have had close contact with someone you live with, but you can avoid further contact. So let's say, you have a bedroom and a bathroom upstairs, you're not going to be around them. You can, leave their food at the door and run away. Your quarantine would start the day, it's the first full day after you stick them in isolation. So you are staying away from that person. And then it would be 14 days. Then the last one here, I live with somebody and I can't stay away from them. So this would be especially like a mom of a 2-year-old is a good example. You can't put that 2-year-old in the attic bedroom and just leave them there. You have to be around them the whole time. And this has happened, and it's caused a lot of problem for that mom not working for 24 days. But that sick person is contagious until here, and you're in quarantine all through here, and then your quarantine starts the day after they stop being contagious. So you're in quarantine for 24 days, basically. So this is really helpful when you have people who can't visualize when their quarantine would be. This one goes through, like, let's say the teacher was at school. Well, let's say somebody was diagnosed with COVID and they were staying with you, and then they went to the hospital, and then your quarantine would start, once they left the house. So hopefully.
Yes, ultimately it's the first full day after the last day of exposure. So if you were exposed to somebody that's positive, like a 2-year-old, and you cannot not be around them the entire time that they're contagious, the quarantine would start the first full day of the last date of exposure or that they were contagious, something like that.
Yep. But that's just a helpful guide when you have people that can't quite visualize that. So
All right, moving on. If a student that has questionable symptoms, fever, congestion, stomachache, and they refuse to get tested and choose to do a 10-day isolation, do I have to treat that as a positive case and quarantine close contacts at school?
And that's where it gets a bit tricky. We typically do not have you do contact tracing and quarantine contacts unless you have a confirmed case or a probable case. Those situations you have to just take case by case. If you have someone where you are really concerned that they have COVID, you may wish to do contact tracing. Typically, what I suggest is you just watch people really closely. And if somebody else develops COVID, then you take action. If you are really concerned, you can notify families and just say, we have someone with symptoms suggestive of COVID, please monitor your children. But that's why it does get really difficult if we can't get a good diagnosis.
I have a quick question. Jennifer, you had mentioned earlier about symptoms that you thought were questionable, and you would consider those symptoms to be a false negative. But those symptoms that you said are not really on the algorithm necessarily, besides the temperature.
Mm-hmm.
So, and then this question about the questionable symptoms, the fever, congestion, stomachache, why are they different?
So the CDC for schools narrowed down the list to be concerned about, to try to reduce the risks of sending kids home unnecessarily. The list of symptoms for COVID, as we know, is really long. There's a lot. But the lists that are on that algorithm are the ones that they kind of narrowed down as the ones most typical in kids that are consistent with COVID. If kids have any of the other symptoms, you can certainly have them go home or have them tested. It just leads to a lot more absenteeism.
Right, which we find, I'm at a small school, but, student comes in, they have a runny nose, they have a cough, they have a sore throat. So, their sore throat is putting them, on the flow chart. But parents say it's allergies. So because they have a sore throat, though, we are giving them those 3 options. But the runny nose and the cough isn't on there. So
the cough is.
Not my sheet. The most recent sheet that I have is not. It says temperature, sore throat, new uncontrolled cough. But wouldn't that be like when they're telling me it's allergies?
Right. So it'd have to be something that's new and different from their normal health conditions. I know this is not easy. I know. But if they're pretty insistent, it's just their allergies. You can just take their word for it. If you look at that kiddo and say, yeah, that's not allergies, you have every right to say, no, he needs to be seen by somebody or get tested. Because a lot of parents and employees will try to find ways to not have to be out of work or out of school. But if they say, no, I get this every year, this is just like my normal allergies, I'm not sick, then you can say, okay, this is normal for them, they're not sick, they don't have to get evaluated.
Okay, so next question, Stacy Young says, I'm sorry, I'm confused. We've been using 14 days all the time, not 10 days. Do you still need quality? Need help with that one?
I think we got it. If you have any other questions, just let me know. We've seen that happen. I'd rather you err on the side of 14 days than err on the side of 10 days. So it's all good.
She says she's good. Thank you. Okay. And then John says, does the 10 days mean 10 working days, which would always include 2 weekends, 4 days adding up to 14? I don't think it's 10 working days. It's 10 days, correct?
Yep. It's 10 calendar days.
10 calendar days. Okay. 1 year clause on saving employee screening records is on the Thrun FAQ MyOSHA last page from Penny. Okay, Trina says, who would we contact if we had a case in our district? We contacted DHD, a form letter was sent to our students provided by DHD. It was mailed to them with the date they can return, but the student's family received another letter from DHD with a different date who wants that student to come back.
Which county are you in, Trina?
We are in Missaukee County. Well, Wexford, Missaukee.
Okay. So I'm wondering if they got a letter from us, the health department.
Governor Whitmer on it. So it was a form letter. It was a weird letter I hadn't seen before, and it was actually it was addressed to the student.
Mm-hmm.
And it said regarding COVID-19 close contact workplace exemption was what was on the letter. That was mailed, that was sent to the, so this a parent had contacted us regarding it, wondering what days I believe the student would be allowed to come back.
Workplace exemption. So I was thinking it was from the contact tracing program at the state, but that workplace exemption, I don't know what that is. Does anyone from District 10 know anything about that who might be on the phone?
Dr. Moritz, this is Janice, and it does sound like that is a letter that TraceForce would send. I think that's the name of their letter, is a workforce exemption letter. And there was a glitch at one point with how TraceForce was calculating their days, so it doesn't surprise me that it may have been off by a day or two.
Okay.
Yeah, I also think that the situation is that if they do not have the onset of symptoms date, go by the date that they received the case and count the days after that. So that also caused some confusion previously.
Well, and these are for close contacts, so they don't have symptoms. But yeah, we've had some issues with date confusion and issues. So yeah, one letter's from our staff and one letter's from the state contact tracing. And we apologize. We know there's been some issues over the last few weeks, and it's the volume. And again, the state hired a lot of new people, and there's been some learning curve issues. So if there's any confusion, just give us a call and we'll help make sure what the correct date is. I really apologize for any confusion.
Thank you so much. It helps us understand what could happen, and we will we'll handle it at our end.
Thank you.
Next question. I have a situation where a student has been in contact with someone who tested positive, so he was told to quarantine, but now he is exhibiting symptoms and has gotten tested, but we are waiting for results. Do those that have been around him need to quarantine now?
So call your local health department and let them know who he is so we can look into that situation. But if he truly was a close contact positive case, then he would be considered a probable case, and his close contacts should now be in quarantine. But before you start all of that, it is good just to check with the health department and make sure that that person really is a close contact and it really was a confirmed case and everything. And get help with the, work with them on the contact tracing. But that would be what we would call a probable case, would be someone is a close contact and then starts getting symptoms. So.
All right, Hillary says, I'm just being mean and telling people they need to see a doctor or get tested. The doctor can tell me it's allergies.
Yeah, and Hillary, I think you're being very pragmatic. I think it's so difficult. It's hard to try to analyze every single thing. I think it's just, there's nothing wrong with saying either get tested or you see a doctor or you come back in 10 days. That's just the way it's got to be. Here's your online learning for 10 days, and we'll see you when you get one of those. To try to figure out all these different scenarios for every single situation is going to drive you crazy. You might miss a kid and let them stay in school that has COVID, and then that would be, a disaster. So I think just saying, it's this, or this, that's the rules, no exceptions. We'll see you once you've checked one of these boxes. I think that's completely appropriate. I know, it might be difficult, but then you won't have well, you did this for this one and not for this one, and those types of things. So thank you for sharing, Hillary.
Okay, that was the last question in the chat box. Does anybody else have any additional questions that they want to either chat or unmute yourself and ask? Going once, going twice. All right, Dr. Morris, I think we're safe to say the questions this week have been answered.
Okay, guys, well, hang in there.
Thank you, Dr. Morris and Janine.
You bet. We'll get the recording on our website. Any documentation that Dr. Morris has, we'll have on our website, as well as do our best to email it out to everybody.